Welcome, everybody. I am going to start, even though the numbers are continuing to join us. I am Professor Roseanne Kenny. I'm president of the Irish Gerontological Society, and I'm very delighted and honoured to be hosting today on behalf of my society, the Irish Gerontological Society. We are an interdisciplinary organisation which enables research and education on ageing that translates into improved age-attuned practices and policies, very similar to our British Geriatric Society colleagues with whom we work very, very closely. So I want to first of all start by congratulating the three key persons who I believe put so much time, effort, and professionalism into developing this exciting day. That's Professor Roman Ortuna, my colleague here, who's Associate Professor of Medical Gerontology, about whom you'll hear later on, who's passionate about this subject and has been amazing, given amazing leadership into orchestrating today. Ms. Sandra Atchison, who's Director of Nursing in Public Health in the Public Health Agency in Northern Ireland, and Alison Patterson, also in Northern Ireland, who is the Frailty Network Coordinator there. This is a very rich potential North-South initiative. And it also offers us an opportunity today at the International Day for Older Persons to make a statement, a public statement for this public lecture about the contribution that our healthcare workers, and particularly our nursing healthcare workers and healthcare assistants, have made during these difficult, challenging 18 months. They have, more than any other group, been put under enormous pressure from a professional perspective. And they've shone a light on how to manage through such troubled waters whilst giving great care and attention to their patients, and making the very, very best of most difficult, challenging, and sometimes almost impossible circumstances. Nonetheless, this is actually an opportunity for us also to reflect on our professions and our shared professions for care of older persons, and how we can actually improve those services that we provide through our professions, to make the quality and dignity and respect of life of older persons better through our auspices. And what we as organizations can do, much like today, to facilitate through education, through training, through research, through working closely with policymakers to ensure better standards, better opportunities, better models of service delivery. Now that we have unmasked some of the delicacies and in many cases inadequacies of our current systems. This all-island Frailty Network is a unique opportunity to combine our experiences and enhance our learnings. And I hope that today will be the first of many joint initiatives on the island for this network. Our Northern Ireland colleagues are very fortunate to have a structured, funded architecture for their Frailty Network, which we're hoping to achieve also in Ireland. So, having given that introduction and thanked those who worked so hard to organize today and highlighted the need for today and the future for our network, I would like to introduce my co-chair, who's the charity director, Pascal McKeown. Pascal is the charity director for Age Northern Ireland, responsible for services, programs, and activities to improve outcomes of older people and ensure everyone can enjoy a better later life. She's worked for over 30 years in the voluntary sector in a variety of roles, which include policy, external relations, service delivery, and advocacy. So Pascal, welcome, and very nice to meet you, if but virtually today.
Thank you very much, Professor Kenny. I certainly want to add my welcome to everyone joining us today. Along with Dr. Lynn Armstrong, I'm the co-chair of the Northern Ireland Frailty Network. And I think this is a wonderful opportunity to share the knowledge and expertise across the island on frailty. I'm particularly delighted to see that we are joined by a number of older people who are members of Age and Eyes Consultative Forum and have been actively involved as members of the Life Experience Group in the work of the Northern Ireland Frailty Network. We have an exciting programme ahead of us, looking at a range of initiatives across the island, and I'm looking forward to hearing more about developments in research, policy and practice. Frailty is everyone's business, and older people consistently tell us, most recently in Age and Eyes Lived Experience Survey, which was launched in September, that staying well and addressing frailty are a priority for them. Engaging with older people, finding out what matters most and involving them as partners should be central to the development, delivery and review of services. So I'm delighted to share with you through a short video, the views of older people on frailty, looking at the impact of COVID-19 and what services should do to help older people step forward with confidence. So could you please bring in the video, Roman? Thank you.
I think we're now in an age where there's more information and more attention now given to trying to prolong later life in a healthy way. And because I've been involved with some of the initiatives with the AGNI, then I'm maybe more informed than some of my other peers who are not involved in that.
I do feel that social interaction is absolutely essential to the daily lives of people who are of older age. The lunch clubs, the casual meetings, the sort of coffee gatherings of one sort or another have always been absolutely essential to keeping us mentally alert. And people have spent months and months and months, if they're living on their own, they haven't seen anybody or spoken to anybody.
I'm very fortunate in that I live still with my husband, and we've had company, but I have friends and neighbours who have been extraordinarily lonely and cut off. And I can see in some of the cases how they've really gone downwards in terms of their physical and mental health.
And people have been reluctant and afraid to go to hospitals, but many have been cancelled, or surgery has been cancelled and put off. And that's added to exactly what Anne P has just described, where people, even those who would like to be out and about a bit more and resume their lives, they just can't because they're no longer physically able.
It's only in hindsight that I look back and I see I was frail. I didn't realise I was frail at the time. I think that was the issue.
Well, in my talking to people from various backgrounds who deal with frailty in their working lives, I still think the emphasis is too much on the physical side. I think it has to be absolutely a balance of the two.
So I think as far as professionals are concerned, I think what's so terribly important is that there is still such division in the way services are provided. They still carve up the services as per our anatomy, as opposed to taking an holistic approach to people. And I think if services could be it wouldn't be a total redesign, so that you're looking at the whole person and their environment, that it's really the only way to deal with frailty.
So we need to have confidence that the lived experience of people is being taken into the production of policy. So the lived experience and the idea of co-production with professionals is one way that we could maybe step forward with a bit more confidence. Because that would mean that rather than decisions being made for us, they're being made with us. And I think that's where Hilda's point might have some value, that we can actually be involved in the system that we want to provide for us, and highlighting that there are different needs and there's no sort of one size fits all idea of what frailty might be.
So thank you very much, Roseanne and Pascal, for those opening remarks. It was lovely to see some familiar faces on your video clip. I'd now like to extend a warm welcome to our next speaker, Bibiana Savin. Bibiana is an acting regional manager for the Southern area in SAGE Advocacy. Over to you, Bibiana.
Hello everyone, my name is Bibiana Savin and I would like to thank you for the invitation today to share with you the lived experience of frailty through the lens of an advocate. Let me first tell you a little about SAGE Advocacy. Our mission is to protect, promote and defend the rights and dignity of vulnerable adults, older people and healthcare patients. So what does this really mean? Well, let's start at the beginning. The first question I want to answer is, what is advocacy? Advocacy is really about ensuring that someone's voice is heard regardless of their circumstances. Independent advocacy will represent an individual's interest, will empower people to secure their rights, will support them to articulate their needs, and will ensure that their voices are heard so that they could exercise meaningful choice. I wonder why is advocacy needed? Because, as many of you will know, a great deal of people face challenges to their independence due to illness, disability, lack of family and community supports, or an inability to access public services that meet their specific needs. But the best way I can show you why advocacy is so important is to share with you some of the real-life experiences of the people we support. Nora is in her late 60s, lived alone in a 2-story house and struggled to climb the stairs to her bedroom. She was admitted to hospital after a fall, and the team in the hospital had concerns about how she would cope at home. She had told them that once was stuck upstairs for 2 days as she lost control of her legs and could not get downstairs. Nora was supported by the advocate to articulate her wishes, explore options and agree on measures to reduce the risks of fall. But unfortunately, when the time came, no home care package could be put in place due to poor housing conditions. Despite the risks, Nora chose to return home and she fell again, was admitted to hospital with a hip fracture. She wants to return home and the advocate is supporting her now to secure additional funding for adaptations to her home. Brian is in his late 70s with vision impairment and the diagnosis of early stages of dementia. Since his wife died, he has lost weight and unfortunately was admitted to hospital with COVID-19. After a while he wanted to return home, but his son was not supportive of this. He thought his father was now too frail to live alone. Brian believed he could manage well at home in familiar surroundings, but the home care package offered to him was insufficient, and he couldn't afford to trial a nursing home while also keeping the rent payments for his house. The advocate worked collaboratively and supported Brian to link in with the Elder Home Share program and the local authority. An agreement to trial a temporary tenancy for a home sharer was secured, and this enabled Brian to return home with a care package complemented by support from a home sharer. Patrick is in his early 80s with mobility issues and living alone in the community. One night he had a blackout, fell, and was found on the floor the next morning by a neighbor. After admission to hospital, Patrick returned home with an increased home care package and was supported also to get a pendant alarm. He wasn't allowed to drive anymore and had to sell his car, which affected him very much. He became afraid to leave his house and depended on others for shopping and hospital appointments. He had to return to hospital for further investigations, and when he came back, he got a letter from his landlord telling him that his home of many years was to be sold. Patrick was very overwhelmed when he contacted SAGE and sad that his life was changing beyond his control. The advocate discovered that Patrick was no longer on the housing list and challenged this with the local authority. After all the necessary documentation was sorted, Patrick was reinstated on the housing list. The advocate made further representations for a housing unit in the same area to allow Patrick to maintain his current circles of support. And so he moved to his new home just in time for Christmas and was looking forward to his housewarming party. I hope the stories would set the scene for the next speakers at today's event. Thank you.
The next speaker is Alison Patterson, the Frailty Network Coordinator, Public Health Agency.
Firstly, on behalf of the Northern Ireland Frailty Network, can I thank Roman, Aisling and colleagues from the Irish Gerontological Society for the opportunity to collaborate on today's conference. Over the next few minutes, I want to outline how our network came about, our progress, priority work areas, and the benefits of a network approach. It all started back in 2018 when the Public Health Agency commissioned some research from AGNI. They interviewed over 700 older adults in Northern Ireland to hear their views about ageing and frailty. It was very clear that this was a priority for them. They wanted access to information and support to enable them to age well, but also to have the confidence that the appropriate care and support would be available when they needed it. Our main policy documents in Northern Ireland task us with supporting people to have long, healthy, active lives. To be able to deliver on this, it's imperative that we work together to ensure that we can deliver the best outcomes for older adults. To think about how we should do this, we held a regional workshop in 2018, bringing together a range of stakeholders. One of the priority actions agreed at that event was the establishment of a Frailty network. That was launched in March 2019. Over 2 years on from the launch, we have over 600 members from across more than 80 organisations. Membership is open to everyone with an interest in ageing and frailty. We have a very strong ethos of co-production and co-design. AGNI are our key partners in the network. To help us progress our work, we have developed a structure that has an oversight group which brings together the Department of Health, the Health and Social Care Board, and the Public Health Agency. We also have an expert panel comprising a very wide range of stakeholders, and a life experience group further amplifies the voice of older adults in our work. We have over time established a number of task and finish groups working on priority areas. You'll hear more from these later in the programme. In 2019, for the first time in Northern Ireland, all 5 of our trusts participated in the NHS benchmarking audit on managing frailty in acute settings. This has given us some much needed data to give us a baseline position. We hope that this and other audits will continue to be used to measure progress as our journey moves ahead. We have the opportunity to pilot the identification of frailty across a range of settings and learn from these, both in terms of benefits perceived by older adults who participated and in the experience of staff. We're also working with colleagues in Trinity College Dublin to develop an economic model for frailty in Northern Ireland. This will be very important to us moving forward, as it will inform our system about the most effective interventions to support older adults at risk of or living with frailty. In terms of our great priority areas, I think we're all aware of the devastating effect that the pandemic has had on older adults. The prevalence figures for frailty that we've been working with are likely to have significantly increased. We need to work harder to identify those impacted and do all we can to support them. On the subject of identification of frailty, this is something that's not routinely done in Northern Ireland, although we know there are pockets of excellent practice out there. We need to put systems in place to enable the identification of frailty across a range of settings. Where frailty is identified, we need to ensure there's an availability of appropriate assessments and care pathways that will deliver the best possible outcomes. We need to ensure education is available to everyone. Learning how to recognise frailty and what to do when it is identified is critical. Our task and finish group will update us on this shortly. Over the last 18 months, we've had the opportunity to work more closely with care homes to understand and address the challenges they're facing and to listen to the views of residents. We are leading on the development of a regional falls pathway for care homes, and I'm pleased to say that it has use of the clinical frailty scale has been built into the wellness pathway. Thinking about the bigger picture, we need to adopt a population health approach to ageing well and prevention of frailty. To bring all of this together and ensure everyone has access to information, education and support, we plan to launch a website in the near future. So how will having a network help us achieve these things? We've been blown away by the high level of interest in frailty and the knowledge that each of our members joined us because they wanted to, not because they had to. Having recognised structure has helped us inform policy and service design. We have built strong relationships with our Department of Health colleagues to highlight the needs of older adults. Our mantra is that frailties is everyone's business, and it follows that there's a role for everyone across all sectors in highlighting this important issue and collectively making things better. The breadth of our membership facilitates this. We are passionate about co-production and co-design. Having access to such a wide range of stakeholders supports this. We have older adults working side by side with a range of professionals and organisations to agree what matters and design the change. We're also able to coordinate work at a regional level in an effort to reduce variation. Today's event is an example of the opportunity we've had to collaborate with colleagues outside Northern Ireland, having also been involved in work through the European Joint Advantage Programme with NHS England and the Scottish Integrated Care Foundation. This helps us share learning across other jurisdictions. Finally, I just want to talk for a minute about our logo, which has huge significance for us. It was designed by older adults as part of the AGNI Consultative Forum. The 3 words describe what members felt were most important to them: support when it's needed, confidence to live your best life, and the strength to do all the things you want to do. The feather signifies all of these things: the strong backbone of the feather and the confidence that when it's given the right supports, it can create flight. If you haven't already become a member of our network, we'd love to welcome you. Just email the address on the slide. Thank you for your time today, and I hope you enjoy the rest of the programme.
I'd like to welcome our next speakers, Professor Roman Romero-Urchino and Dr. Ronan O'Queeve. Roman is an associate professor at Trinity College and consultant at St James Hospital, Dublin, and Ronan is consultant geriatrician at Mercy University Hospital in Cork.
Thanks, Alison. Obviously, listening to your talk, it's truly inspirational hearing the developments of the Frailty Network in Northern Ireland, something that we can look to aspire to achieve ourselves here in Ireland. So I'm going to talk a little bit about the interest group that we've developed, the Irish Frailty Network within the IGS, from its inception to where we are today. So research and clinical practice of frailty has developed a lot in the last 10 years. And certainly over the last 5 years in Ireland, there's been increasing interest in frailty. And this has created an awareness that there's a need to develop an interest group to drive education, quality initiatives, and research policy into frailty. This was first proposed in advance of a summit meeting in Dublin Castle in December of 2018, the Framing Frailty Summit meeting. And I suppose a number of key stakeholders got together to discuss the potential to develop an interest group within the IGS that would act as the foundation for a Frailty Network. And this is very much linked in with aligned programs and societies in Ireland that also have an interest in the development of ageing and frailty practice, policy, and research in Ireland. These include the Irish Society of Physicians in Geriatric Medicine, the National Clinical Programme for Older People, and the Integrated Care Programme. The development of the National Frailty Education Programme in conjunction with both the National Clinical Programme for Older People and TILDA was a very strong driving force for the development of this interest group and network. And obviously taking inspiration from the Northern Ireland network, we're beginning to develop the core foundations for a broader all-Ireland frailty network. So we were first launched in September of 2019 at the Gerontological Scientific meeting. And Over the last year, we have been challenged by the COVID-19 pandemic, and that has, I suppose, brought about some challenges in relation to how we have developed over the last year and a half. But despite that, we have had some achievements. Roman, if you could just bring up the next slide, thanks. These have been across some of the core pillars of the Frailty Network, including networking activities. These include the developmental blog, kindly hosted by the Irish Gerontological Society, and different presentations to both increase the awareness and to focus the direction of the Frailty Network nationally and at different society meetings across the country. We've also been involved in education in relation to frailty, helping to support the National Frailty Education Programme, to review materials, to advise and consult on those. We've also been involved in the development of a number of webinars, again, exploring different aspects of frailty in conjunction with the IGS. And we've also developed some research papers looking at frailty in the setting of COVID-19, and a number of Delphi projects looking at core aspects of frailty medicine as well. So that's what we've achieved up to this point. And I'll hand over to my colleague, Roman, to discuss where we go from here. Thanks.
Thank you very much, Ron. And as you said, it's been a series of achievements bringing us back up to 2.5 years from here. And one of my most memorable collaborating times with the Northern Ireland Frailty Network was the celebration of the 1st October International Day for Older People, exactly 2 years ago from today. Where I had the privilege to be invited by the Northern Ireland Frailty Network with a delegation of academics and researchers from Trinity and other universities in the South to celebrate this day in Craigavon Conference Centre, where we had a wealth of content, and not only from the academic but also from the lived experience. I clearly remember how Emily described her personal experience of frailty, and how, as we heard in the personal testimonies from Pascal's presentation and that wonderful NI video with good vibrations, that the lived experience of frailty has to be increasingly taken into account from the academic, service improvement, quality improvement, and research endeavors. And at that point, we were very tenuously explaining that the Irish Frailty Network interest group within the Irish Gerontological Society was just being developed. And here we are today celebrating and stepping forward with confidence on this International Day for the Older Person 2021. Little we knew what was happening within those 2 years, but certainly there's been a lot of challenges, and there's been a lot of learning that we can share moving forward. The future looks bright. We are really intending to continue to collaborate, develop more joint learning events, developing closer working relationships between these networks. On all the pillars, on education, research opportunities, quality improvement initiatives, and development of continuous professional development for clinicians and for frontline professionals across all the disciplines, but also giving access to higher education opportunities where possible. We would really want to work with higher education institutions to develop formal courses on frailty. We have been doing some work this last couple of years in Trinity College Dublin, where we now have a dedicated standalone module on the assessment and management of frailty within the School of Medicine, but also catering for all the allied health professionals in a truly interdisciplinary fashion, which, with the great support from Professor Aisling O'Halloran from the Irish Gerontological Society and the Department of Medical Gerontology in Trinity, we have upscaled that to a formal postgraduate certificate in aging and frailty studies, which is now starting this academic year. So we just really want to continue to embed frailty education in higher education institutions, and also teach the latest research that's coming out from all the research that's happening around frailty, and incorporate that in the postgraduate curricula for everyone to enjoy, and to continue those updates to actually develop that to good patient care, which is evidence-based, compassionate, and also solidly evidence-based. We would really want to continue towards an all-Ireland Frailty Network, and I'm really looking forward to the next steps. Thanks very much to all, and I hope you continue to enjoy this day.
Thank you very much indeed to both Roman and Ronan, and great strides being made there. I'm delighted to introduce the two next speakers. The first is Professor Charlotte McCardle, and Professor McCardle is the Chief Nursing Officer for Northern Ireland, the head of the nursing and midwifery professions, and responsible for professional leadership, performance, and development of the professions in Northern Ireland, including providing support to the department's lead allied health professions, the AHP. Now, as well as Charlotte, I'm also delighted to introduce for this next section, Rachel McKenna, who's the newly appointed Chief Nursing Officer in Ireland. A registered nurse, her expertise is extensive, including clinical and managerial experience for almost 30 years in both Ireland and the United Kingdom. And she's worked as a Deputy Chief Nursing Officer in the Department of Health since 2018. Her primary area of responsibility is nursing policy for patient systems and clinical governance. So without further ado, let's welcome Charlotte and Rachel together. Thank you.
Okay, so well, as I said, good afternoon, everyone. I'm delighted to be here this afternoon to join you today to celebrate the International Day of the Older Person. And I would like to thank Sandra Aitchison for inviting me to present today, and commend the Northern Ireland Frailty Network and the Irish Gerontological Society and the Irish Frailty Network for organising such a fantastic event with a great range of speakers, and particularly when we're also challenged by not being able to be together in one room. It's been widely reported that frailty is one of the leading causes of poorer outcomes for older people. And as Alison has already mentioned, we listened to what older people, adults told us in the Northern Ireland Frailty Network, and we established, with the support of the Department of Health, the network to create an impetus for improvement and change in Northern Ireland. The data, of course, from other parts of the UK tells us that a proportion of people living with frailty rises with increasing age, from around 6.5% in the years 60 to 69 to 65% in those in the over 90 category. And around 3% of the population aged 65 plus are likely to be living with severe frailty, while 20% with moderate frailty and 35% with mild frailty, and that comes from a BMA publication in 2018. But of course, COVID-19 and the restrictions that has brought us to where we are has had a very significant impact on older people. COVID-19 has brought us with restrictions, has had a hugely significant impact on older people, increasing levels of deconditioning, isolation, loneliness, as well as other symptoms which may have been undetected due to changes in how they access services. And I think it's likely that now the number of older people, adults living with frailty, is going to be far greater than it was pre-pandemic. And of course, that brings with us challenges to how service is provided and how older people maintain independence and activity moving forward. And on the next slide, please. We recognise that our system continues to be under pressure, and as a result of COVID restrictions, we are hearing from services that are seeing adults who are presenting with a range of needs. For example, the Falls team are reporting receiving referrals from much younger groups than they would have done pre-pandemic because of, I assume, lack of inactivity and reduction in muscle mass, etc. Therefore, the challenges that the Frailty Network, the Northern Ireland Frailty Network, have continued to champion the needs of people living with frailty by informing planning and policy direction, sharing learning and providing guidance to support teams and enable them to deliver the best possible care. And as Alison's already said, the Frailty Network brings older people in Northern Ireland to the forefront of policy making and service design through a strong co-production focus. And I certainly feel that the Northern Ireland Frailty Network have been hugely important and influenced quite a lot of policy during COVID-19 in particular. The next slide, please. I was delighted to hear the voices of older people at the recent Pensioners Parliament in September, where questions were put to our Minister for Health about prioritising healthy ageing and the need for living with frailty, as well as equality of access to health and social care. services. Other important issues were raised around transport, housing, and many other issues that concern older people. But never has it been more important to understand and respond to these challenges than it is at the moment for our elderly population. And on the next slide, you can see a definition of confidence, which is what today's conference is all about, stepping forward with confidence. And the definition of confidence is a belief in oneself, the conviction that one has the ability to meet life's challenges and to succeed, and the willingness to act accordingly. So I think it's a really appropriate title for the conference today, both in terms of the networks that are established, but also for older people themselves and how we recover and build back better our health services when eventually we get through the pandemic, which will in turn, it will happen. Moving forward then to the next slide. As we have also just heard from Alison, confidence is one of the pillars of the Frailty Network. So it must be our priority to give older people the confidence to enjoy their later life and to cope with the challenges and to provide tools for them to help them succeed and live long, healthy, active lives. Our policy direction is to support people in that way. It's a very clear policy statement from government in Programme for Government. And in Northern Ireland, we are working together to support everyone to understand the benefits that making better lifestyle choices can have on how we all age. And we strive for services that focus on quality of life and population health, but we also need a system that is driven by the voices of older people. And we want to ensure the unique needs of older people are understood, recognised, and then most importantly met across every part of our system, and that there's equity of access to care no matter where people live. And we need to care and take decisions about care with older people to be able to deliver the best outcome for everybody. At all levels, we will consider the specific needs of people living with frailty when we plan and design services, because we know that everybody's an individual and one size simply won't fit everybody. And we need to work across all sectors to ensure that our different services can be tailored to meet the needs of older people. And that we deliver what's important to them and what really matters to them. And that's why I think co-production is so important, that it doesn't become a paternalistic approach of healthcare professionals telling people what they need, but that we listen to what is important to the person and the people in front of us. The Department of Health and the social care sector will work with other departments and sectors to deliver on this ambitious policy direction. Much work has already been done across many areas, and one area we're really focusing on is enhancing clinical care framework for care homes. And we know that, there is a high concentration of people living in with frailty in care homes. And the Frailty Network are supporting the department to enhance and improve the care and associated quality of the life of residents. And I mean, it really struck me during the pandemic, at the start of the pandemic, when we were having difficulties supplying PPE, that we did an audit of the number of people in care homes who needed respiratory support, and actually it was much higher than I had anticipated. And the needs of people in care homes are quite a high level of acuity. And one of the examples of the work that's been done through this, the enhanced care clinical care framework, is around falls and the development of a regional falls pathway. And we know that falls are one of the symptoms of frailty and one of the biggest challenges for older people. And our ambition is to promote safer mobility and maximise outcomes for all those who experience a fall. And we will hear further updates from the Northern Ireland Frailty Network on their work throughout this afternoon's programme, including developments on education. And finally, in closing then, I'd like to thank you all for giving me the opportunity to speak today. Ageing and frailty is a hugely important subject to me personally. My background is in older people's nursing, and I'm also very committed to co-production and person-centred care. So this is a really good opportunity for me to speak with you, and to collaborate and to take an all-Ireland approach on frailty is one, I think, an opportunity, in my opinion, not to be missed. We have so much to learn from each other when we work together. In fact, colleagues have been sharing knowledge and research about frailty through recent years, and strong relationships have already been built, and there are good foundations to build upon. So before I hand over to the next speaker, Rachel, my colleague, I must pay tribute to all the older adults. Their resilience during this difficult time has been simply amazing. Even thinking about my own elderly folk, my mum and aunts, and how they have been so resilient during what has been an extremely difficult time for them, where their world has shrunk even smaller because of the restrictions that have been placed upon us. I also want to thank all of our frontline workers, all the staff, the carers, good neighbours and the volunteers from across all the sectors and all walks of life who played such a really important part in protecting the population and in particular older people. Your commitment and your passion and your strength in what continues to be a highly pressurized environment is really unbounding, and I'm very proud of all the work that you do. We are simply blessed to have such wonderful staff, and it is the spirit that I know will enable you to step forward in confidence and to deliver the service to older people that they really truly deserve. So thank you so much for listening, and thanks for the opportunity to speak today.
Over to you, Rachel. Thank you very much indeed, Charlotte.
Thank you, Roseanne. Thank you, Charlotte. And good afternoon, everybody. I'm delighted to be here to talk to you and to get the chance to address this wonderful webinar this afternoon. I am going to talk to you on the policy focus for older people living with frailty, on the nursing and midwifery contribution. And I do have some slides, and I'm wondering, Romero, are you able to share them?
Yes.
Great. Okay. As Chief Nursing Officer, the main part of my job is the development of nursing and midwifery policy. And the primary responsibility of nursing and midwifery policy is to achieve national public health goals through nursing and midwifery by the provision of innovative solutions to care. And this is particularly applicable in the area of frailty. So nursing and midwifery policy works because nursing and midwifery have such a broad capacity across the health system. They have the capacity to bridge the gap between access and coverage. They have the capacity to coordinate increasingly complex care, to fulfill the potential as primary caregivers to the full extent of their education and training. And they have the ability then to enable the full economic value of nursing and midwifery contribution of care. And then they can change the reference point from which nursing and midwifery are judged. And this is through evidence and research and the application of innovative solutions for care. And this is particularly applicable, as I said earlier, to frailty care and older persons care. The next slide, I think we've probably covered but it's good to see it in a visual, is that the increase in population, and particularly in the over age 65 group of our population, that is growing, and that means that we're going to have a lot more people to care for in this age group as we move through. That's an important consideration for the development of policy in this area. Next slide then. Just gives a different visual in terms of the aging population, but it has an impact in many ways for the development of policy. Increased dependency on the healthcare system in later life, with increasing numbers of people requiring that type of care. We have a reduced workforce compared to patient numbers, and that's a particular challenge at the moment, I suppose, in the context of policy. And we have a lower percentage of people then paying tax into the public health system. So the economic factors that influence policy development as well need to be considered. And the next slide, please. So really important data then that's very influential in terms of policy development. I'm not going to read out all that on the slide, but they are important indicators for consideration for policy development. The emerging evidence suggests that a proactive intervention in community dwellings for older persons and those presenting to acute hospital at risk of frailty may reduce prevalence and improve outcomes for this community of individuals. Research has shown us that the frail older person is much more vulnerable to adverse health outcomes, and as previously spoken about by Charlotte and others, such as falls, hospitalizations, disability and mortality, and frailty status at the time of acute hospital admission predicts adverse outcomes, including discharge to residential settings, development of pressure ulcers and mortality. People living with frailty are much more likely to experience decline in mental health, including lower levels of cognitive function and higher levels of depressive symptoms. And these are really important when we're considering of what is required to inform our policy directions. But frailty is not inevitable and it can be avoided, delayed and reversed with timely and appropriate interventions. And this is a really key consideration, particularly when we think of nursing and the nursing workforce and the breadth that nursing have in terms of provision of this care. Next slide. In Ireland, COVID-19, no more than any other country in the world, had a significant impact, particularly in our nursing home, long care, residential care facilities. As a result, we've had a nursing home expert panel and the publication of that report in August 2020. And this is a really key report in terms of it contains a range of recommendations in line with the lessons learned to date and the international best practice aimed at safeguarding vulnerable residents in nursing homes. So a really key report in terms of the policy world. The Department of Health established an implementation oversight team to oversee the implementation of these recommendations and ensure ongoing protection and support for nursing home residents during COVID-19, because we all know it's not quite over yet, even though it's a lot better. The Chief Nursing Office have been key to this report and have provided input into the recommendations, including the development of safe staffing frameworks for long care residential settings, education profile for the staff within the sector and what that should look like into the future to deliver best outcomes for our older populations. The role of nursing leadership in community teams and learning from these as permanent community support teams are established, and the regulatory reform of the sector. And all of these are key in terms of improving services. Next slide. So looking then at the policy response to frailty, coming from a place where many hospitals are outdated and not functioning at the capacity of the modern day healthcare system requirements. I'm really pleased to hear earlier on about the importance of the lived experience and advocates in directing and supporting policy development. This is so important and certainly something that I'm very keen to expand on in Ireland. Next slide, please. There's a number of challenges for policy and integration of care that are well, I think, documented and evidenced. But I suppose where we link all of these challenges, we've got to think of the context. And the context in Ireland is that of Sláinte Care, which is hoping to provide or aiming to provide universal healthcare. And it sets out how they're going to do this. Recognising the current difficulties and challenge in order to positively impact and change the culture and inspire change is really, really important. As mentioned, this nursing home expert panel recommendation is part of that challenge, and the policy then has an opportunity to address some of these challenges and concerns. Nursing and midwifery have a big role to play across the whole of the health sector, but nursing in particular in the care of frailty care have a number of roles and responsibilities. Next slide, please. You will see that we have the capacity then to keep people at home and reduce lengths of stay in hospital. We also have through community enhanced community care networks, we can proactively provide care and maintain health. There's a significant role in safeguarding vulnerable populations. And the nursing role is critical in signposting the coordination of complex care systems. Through enhanced practice then, including technology-enabled care and shared care with community and the mobility of nursing care delivered through blended models of remote and direct care is another way that the nursing and midwifery contribution is well recognised. Through leadership then, we can ensure that workforce is grounded in science, technology, teamwork and equity, and that it supports flexibility of nursing roles and skill sets that are transferable across the community and acute services. This includes upskilling of community nursing, chronic disease management, and acute hospital nursing management, case management for patients right across the system. And then also it's really lovely to hear earlier about the importance of co-production. And that is how we have got as far as we have in terms of identifying our indicators to inform policy development. And it's critical for person-centred care. As Chief Nursing Officer, I'm well used to an all-Ireland approach to many aspects of the work. So I'd really like to acknowledge the broad collaboration that I'm hearing about here today, and that's very evident in terms of the webinar. Next slide, please. This is just an example of one of our latest policy responses in terms of applicable care for older persons living with frailty. The Chief Nursing Office advocates for the development of policy and systems to identify and manage frailty in older persons presenting to acute and community services at earlier stages in the presentation. Earlier this year, throughout COVID-19, we published a report entitled The Testing and Results of an Integrated Nurse-Led Community Virtual Ward Proof of Concept. This community virtual ward is a flexible and integrated model working across the community and hospital settings, receiving admissions for both areas. It is termed a virtual ward because the care is delivered in the community, mostly in the person's home. The beds are not physical, but virtual beds. It operates very similarly to a ward where the team of nurses provide care for the duration of the admission and afterwards. The community virtual ward has been adopted and adapted internationally to meet the needs of various populations, including chronic disease management, older persons care, and responses to COVID-19. So it's very applicable and all showing very positive outcomes. It also supports Sláinte care, which is the overall health policy direction, bringing care closer to home and care that is not dependent on the setting of the care delivery, with a focus on patient need, largely hearing the patient voice and targeting treatable conditions to reduce the demand on acute hospital systems. As a final point, I would like to acknowledge the adaptability and flexibility of staff all across the sector of care of older persons with frailty. You've crossed boundaries and working together to ensure that your residents and older people are receiving the best of care. And I too, as Charlotte did, would like to acknowledge the contribution of older people who cocooned and protected themselves through very difficult times. And also to acknowledge the contribution of all our nurses across the sector for the wonderful work that you have done over the last 2 years in particular. Thank you.
Wonderful. Thank you very much, both to Charlotte and to Rachel. And how exciting that we're approaching an aging in place model where people will be able to choose where they wish to age and where they wish to end their years. So in the spirit of being eclectic, which this meeting very much is, it gives me great pleasure to introduce Marina Cassidy. Marina is the artist in residence at the Creative Life Centre in Mercer's Institute for Successful Aging. That's where I am now. It's a purpose-built clinical research facility for aging, supported by Atlantic Philanthropies and a pet project of Chuck Feeney's, and supported by our Department of Health and Health Service Executive. So within that institute, we have a creative life pillar, and it's in the very atrium, the hub of the institute, so that staff, carers, families, patients can engage with creativity. Marina is currently our artist in residence, and I'm absolutely delighted to welcome such an experienced and gifted musician who herself has studied music therapy and its value in teaching and performance, particularly for patients. So without further ado, thank you.
Cassidy. I'm a music therapist, and during my artistic residence in Creative Ireland from September to Christmas last year, during COVID-19, I wrote this song about the experience of patients of masks and those of us taking care of them, how we needed to communicate with our eyes and reassure them that behind the mask we're there. You can't see my face, and I can't hold your hand, but as I hold your gaze, I hope you understand. This voice is strong for you, these eyes share your fear. Our world's been turned upside down, but even with this mask, and even in disguise, I am here. Gasping for breath,